Today, I'm getting plastic surgery. Hopefully I don't pass out.
Everyone is convinced that Nikocado Avocado is lying about his weight loss transformation.
Does it look like I acted out gaining 250 pounds?
When you have 250 pounds coming off your face, literally melting, it just pools right here. And for the longest time, no one could tell because I know my angles, but the moment I turn my profile, okay, this is what we have, everybody. This is what we have. You know, I play violin, and it looks like this when I'm playing. We can't have that. Some British plastic surgeon said if I had to get my own face done, there's only like 4 or 5 doctors I would trust. Ben Talei was the first one he mentioned. I went to his website, I looked at his photos, and I could really see that this was what I need. And consistency throughout all of his before and afters. I'm getting the AuraLyft, which is Dr. Ben Talei's signature procedure. It's basically a deep plane lift. And I just want all this just pulled back. And it never looked this bad before, like the slope.
Yeah. Here, put your head back on.
There's a lot of skin.
Yeah.
There's so much skin.
Yeah, so because of the skin, let's say we really wanted to maximize, then I would actually extend the incision here, kind of more like a facelift incision to right there.
It's not just pulling the skin, it's going under the skin to the soft tissues, kind of manipulating those muscles and moving the muscles as well. So basically, it's supposed to be longer lasting, and it's considered the gold standard. By trimming, you kind of pull up and trim from the top, like a ribbon type of thing?
Yeah, well, I go in here first, and I tighten up the muscles.
Okay.
And then I go out over here, release everything, and come up against it. So you get movements in both directions. So you'll see all of it disappears.
And all that, then this will go away.
Yeah.
I don't want to look like a different person. I mean, everyone gets plastic surgery for different reasons. Some people want to look like a different person, and that's okay. I'm not here to downplay that. I'm pinching myself that I'm here because I have extreme invasive vagal syndrome where you pass out from basically anything related to medical. I know I won't come out with cat eyes or looking like a different person. I'm very confident that it's going to look good. I'm just worried for the pain. Dr. Talei, I know you're watching probably. Hi. My life is in your hands. I know it's gonna turn out great. And I'm just nervous. I hope I don't like pee myself or poop myself.
I'm so excited. It's so much emotion. I'm very nervous. I'm most nervous for the IV, as you guys know. But I'm also really excited for the results. I'm so excited for this to happen. And yes, I'm in the bathroom. Don't say anything. I'm like, they're gonna have me change into my gown now, and then they're gonna like hook me up to all the stuff. Oh my God.
My heart's going bump already. I'm doing this for myself. I'm doing this for the violin. I'm doing this for my haters who say, oh, you have a double chin? Yeah, well, now what are you gonna say? Nothing.
I'm pretty sure they're doing a fat graft, so they take something from my stomach or my thigh. And I think they're gonna put it right here on my chin because I don't want a chin implant. He knows what he's doing. I said, do your thing.
Nikocado Avocado has gone through a journey over the past 2 years of a pretty substantial weight loss to the tune of about 250 pounds. So that's a massive amount of weight loss, which structurally on him hasn't had a huge effect, which is fantastic. What we're left with, however, is this, which is not so fun to have when you're a young guy. The platysma in these areas becomes less mobile when you grab it than here. This is more mobile. This is what we call the glide plane in that layer 4 over the masseter, because the two muscles have to glide independently. So here, if you can see, there's a little bit of an angulation from the lip coming back to the chin because the teeth are slightly forward and his lip is slightly high on his premaxilla. But what you notice if you close your mouth, you look right there, there's a little chin twitch. Yeah, he's turning light already.
Okay.
Taking a break. That's all right, I got a good chair for it. So he's out right now. So just give him a little extra blood flow. And then as he wakes up, he's gonna say, what happened? Oh no, did I pass out? Yeah, a little bit of a faint. A gentle one though. Very elegant.
How does this muscle get shaped to go in?
I just tuck it a little bit this way and then lift against it.
Okay.
Yeah. That's it. So I'm gonna sit you up. Feel okay?
Yeah.
All right, good.
2 steps ahead. I am always 2 steps ahead.
These netting sutures are going to come off day 3 or 4, usually day 3, so 72 hours. We're going to take off the head wrap tomorrow morning.
We're done. We did it.
Yay! You are snatched.
Just finished my surgery.
It was very hard to fall asleep. I slept probably 2 hours in total. I will say that my tooth extraction hurt way more, and the pain before and after the tooth extraction hurt way more. Reem and Esther were the best nurses I've ever experienced.
You did it.
There she is. I was
One
just
day.
talking about
It
you.
worked. You are not even 24 hours post-surgery. You have responded so far so fabulous. I can't wait to show you.
Her face, I'm looking at her expressions.
I want you to concentrate on your jaw. It's amazing.
Just, wow. It's so strong, it's very meaty. It
Yeah.
looks like there's an implant.
And there is not. It looks healthy. And I didn't even put much fat in there.
I was just about to ask, how much did you even put?
Oh, really small amount.
I've actually cried.
Yeah?
Twice.
Tears of joy.
Tears of joy.
There's going to be so much commotion about this plastic surgery. I can see it already. Plastic surgery is extreme, first of all. It's expensive. Even the first week, you're not going to look like how you're supposed to look when you're finished. It's going to look like you were a piñata at someone's party. The teeniest bit of weight gain is going to give me a double chin. I've always had issues with that. It was never that extreme. And then I gained all the weight, and we know what I looked like, right? I gained weight all over my face, the sides, the forehead. I look like a completely different person.
Is he gone now that your weight is gone, or?
I don't know.
Okay.
I don't know. I mean, I can snap into it any moment.
Because now he's gonna have like an AuraLyft. So what's?
I mean, that could be a thing for Nikocado, right? Nikocado could be just like queen of plastic surgery now. And you're like, what's next? The lips, the nose, hair transplant? I don't know. Hopefully I look even better than when I started this.
The fact that everyone is telling me it's going to get better, it's hard to find the words to describe the feeling. It's amazement, true, utter amazement. I figured I would be passing out and being a drama queen through this whole ride, and I haven't, actually. The medicine, it's very minimal. It's like 4 things a day. One of them's good for pain, one's for antibiotic, whatever. I take them as I'm supposed to, and it, honestly, tooth pain is worse. Okay. I'm just thinking about avocados. Really? Really? I think I'm just hungry again.
So we're closing the chapter with an AuraLyft from Dr. Ben Talei of Beverly Hills.
Now I actually have a jawline. I feel like a regular person, like I have what everyone else has that I've always wanted. I'm trying not to laugh or cry, but that's just the truth.